My name is Ptacek. I'm from David City, Nebraska originally, and came to the medical center for my medical education. Then went to West Virginia for my residency program, and eventually settled in O'Neill, Nebraska, where I practiced rural medicine for 25 years, and now I'm in Omaha, Nebraska, teaching at Clarkson Family Medicine. I like working for Nebraska Medicine because it is an academic medical center. It gives me the opportunity to teach. After 25 years in O'Neill, I felt that I had gotten the skills that I needed, and it was time for me to give something back. I decided to go into family medicine because of the variety. We get to do just about everything. And one of the things that I try to teach the residents now is that every time you go into the room, it's an adventure. So it's kind of like Indiana Jones. And when you walk into the room, you don't know what's going to hit you. So it could be a child with a cough, it could be an elderly person with a bunion on their foot or a sore foot, it could be some more serious problems, it can be some very minor problems. And I found that to be probably the most satisfying part of rural medicine and family practice, is that the variety was spectacular. When I was growing up, I was in rural Nebraska, and there was just a shortage of physicians at that time. I decided at that time it would be a great opportunity to come back to rural Nebraska, and one way I could contribute was to be a doctor. So I finished my medical school at Omaha at the Med Center, then went to Clarkson, West Virginia, did my family practice program. I was able to learn essentially everything that a family doctor can do, including obstetrics, geriatrics, pediatrics, and then went to O'Neill for 25 years and used those skills. When I first sit down with a patient, I like to be informal. So I like to have about 30 to 60 seconds where we just talk about me and we talk about them and what we like to do and what we don't like to do, so we get to know each other. As we start to get into the encounter, a lot of things can be uncomfortable when you're dealing with medicine and family medicine especially, and there's a lot of sensitive issues. So it's nice to have that little time at the beginning of the interview to just get to know each other. When I'm not practicing medicine, I enjoy flying my airplane. I built an airplane so that it gives me the opportunity to go visit my children. I have 4 children. They're all over the United States, and my airplane gives me the opportunity to visit with them as often as I can. And when I'm not flying the airplane, I'm usually maintaining the airplane or repairing the airplane. So it's pretty much a full-time job after medicine.